this disease. So the affected dogs used to show very much dullness and depression, and very typically, it is very much typical. I mean, this is the disease where you will have this fever in 2 phases, what we call diphasic fevers. So it used to be happen, I mean, after 3 to 6 days after the infection. And in the early infection stage, there will be severe destruction of the WBCs leading to leukopenia. I mean, reduction in the number of WBCs. Then the dogs will show coughing, sneezing, dyspnea. I mean, this respiratory and this distress or difficulty in breathing. Okay, then diarrhea and vomition, this indicating the involvement of the GI tract, nasal and ocular discharges, and GI and as well as the respiratory system catarrhal inflammatory reaction, causing this producing this nasal and ocular secretion, as well as this diarrhea and all catarrhal inflammatory reaction of the intestines, right? Then one very particular this sign is I'm showing here, and if you see the foot pad, okay, so very much highly thickening, and this hardening of the foot pad used to be there. That is due to hyperkeratosis, and this condition also used to be in the nose. Okay, not only on the foot pad, so nose also used to show keratosis. So this used to show very much hard and forming of the hard pad. I mean, there's a foot pad as well as the nose. That is very much common. Okay, in this canine distemper, and there may be excessive session, and most commonly there used to be invaders. I mean, this like bacterial infections causing secondary bacterial infections, and the animal will show the loss of appetite, anorexia, and depression. And enamel used to show hypoplastic changes. Okay. Someone is waiting for joining, I think. Just a minute. Then, so far the clinical signs involving the CNS, central nervous system, are concerned. So that is mainly due to demyelination, removal of the myelin sheath. I mean, destruction. Okay. So there you may have this myoclonus, seizures, depression, paralysis, incoordination, ataxia, muscle tremors, meningeal signs of hyperesthesia, and cervical rigidity. I mean, all those these signs involving this CNS, like some form of this imbalance in this incoordination in movement, and muscle tremors, tremoring of the muscle, contraction, then paralysis for all these limbs may be showing this paralytic condition, and muscle also may show some this rigidity. Okay, and seizuring this seizure, this strict this rigidity, stiffening of the limbs, and even body muscle and all these things, right? And even the cervical, this portion used to be very much rigid, very much stiff. And one very common this condition, so far this chronic this case is concerned, okay, that is commonly known as, in case of the all aged dogs, commonly known as all dog encephalitis, affecting and or causing inflammatory reaction of the brain, commonly known as all dog encephalitis. And in this case, when there is encephalitis of the all aged dogs and all, so they used to have mental disorders, circling movement, and head pressing, means they used to go on hard objects and pressing their head. Okay, and motor deterioration, as well as finally death, comatose and death. So that used to be as in case of this all dog encephalitis. Okay, then these are some more, and this is from different sources, clinical science continuation, of course. So please go through it, as we have already discussed. Okay, then these are also from different sources. And one thing here means I have this forgot to mention. Another this sign, so far the external examination of the body is concerned. In the abdominal, this portion, okay, particularly, and the inner thigh region, very typically small pustules, means leading to pustular dermatitis inflammatory condition of the skin with formation of development of the stools. That used to be very common, okay, in many of the cases. And of course, that hyperkeratosis of this footbed and the nose. So these things are very important, and the respiratory problems, then the neurological signs and diarrhea and vomition, right? Then these are the lesions, as I was talking about, vascular dermatitis. So in the abdomen region, inner thigh regions and all. So this portion, mostly they used to show so many this small pus pill and this pustules. Okay, so vascular dermatitis is also one of the common sign when you examine this body externally. I mean the animal, affected animal, right? Then coming to these lesions, one of the most consistent PM finding is thymic atrophy. The thymus gland used to be atrophied mostly in these young puppies. And the hyperkeratosis, as we have already discussed, of the nose and the footpad, that used to be very discommon along with the neurological signs. Okay, so one thing, this difficulty is that because of the neurological signs, sometimes people used to have confusion or misdiagnosed with rabies sometimes, and the salivation also it is to be here in this case. Okay, so sometimes people used to think about this rabies. So differential diagnosis is important and it should be done. And depending upon the degree of secondary bacterial infection, as I was talking about, I mean sometimes some secondary invaders, bacterial organisms used to be there. So in such cases, bronchopneumonia, enteritis, and skin pustules are most commonly observed. So whenever you have this pustular dermatitis on the skin, mostly on the abdomen and the inner thigh regions, then bronchopneumonia and this enteritis, and then you can think of that that might have been already secondary bacterial invasion. I mean this bacterial infection is there. And histologically, I mean mostly the lymphoid tissues, okay, used to be affected, and there means there will be necrotic changes of the lymphocytic cells. Then there will be interstitial pneumonia, and one very particular, so far this histopathology is concerned, microscopic changes is concerned. Here almost you can say pathognomonic, I mean microscopic lesion used to be there. That is presence of both intracytoplasmic and intranuclear inclusion bodies in the respiratory, urinary, as well as gastrointestinal tract epithelium. So when you examine these epithelial cells of the respiratory, urinary, as well as the GI tract under the microscope after staining and all, then you will observe, you can note the presence of both intracytoplasmic and intranuclear inclusion bodies. So this is very much specific for this disease. It doesn't happen in other diseases. Okay, both these inclusion bodies. And the lesions which are observed in the brains of the affected dogs with the neurological complications and this neuronal degeneration, I mean the changes maybe of this gliosis, demyelination, and perivascular coughing, as well as non-suppurative leptomeningitis, and the presence of intranuclear inclusion bodies in the glial cells. Okay. These are some of these lesions, I mean these gross lesions, and these are also this affected lungs, showing the this pneumonic changes, diffuse this pneumonic these lesions. Okay, severe this, then intranuclear and intracytoplasmic inclusion bodies. Okay, intranuclear, intracytoplasmic, like this. So this way, both intranuclear these inclusion bodies, intranuclear as well as intracytoplasmic, used to be present in the respiratory epithelial cells, or I mean in the this GI tract epithelial or urinary, or sometimes in the glial cells in the brain. Okay, so then I mean this perivascular coughing means just around the vessels when you make the sections of the brain. Okay, so you will find aggregation or infiltration of lymphocytic cells just around the vessel, what we call perivascular coughing. So these are very much important. Okay, so these are some more this affection, I mean, of the brain, showing different and these changes, this vacuolation of the white matter, showing this demyelination, and glitter cells, I mean this infiltration. Okay, then perivascular coughing, and this one perivascular cuffing and glitter shell, and this proliferation, and this gametocytic astrocytosis with intranuclear inclusion bodies in the this brain tissue. Okay. Then this one I'm just skipping. Now coming to the diagnosis, tentative diagnosis of these affected animals, showing this clinical signs of nervous system, then and this chronic this antibiotic unresponsive respiratory disease is there. Then you can think of, you can suspect that, or maybe of this kind, this canine distemper. And if you examine the blood sample, so you will find low lymphocyte count, reduction in the platelet count, then reduction in levels of the blood, blood proteins, and then means this kind of this clinical, these pathological changes in the blood particularly, but it is not specific for this disease only. So we cannot say that if it is there, it should be of canine distemper, because it is not specific. In many of the diseases also, there may be such kind of this blood and this examine, when you examine the blood, such kind of this changes may be there. So accurate diagnosis of this disease infection involves serological as well as molecular biological techniques. Okay, like this ELISA for the detection of the viral antigen from the serum, or as well as the central and the cerebral spinal fluid, then RT-PCR for the detection of the viral this nucleic acid, then immunofluorescence and immunohistochemistry also for the detection antigen from the nasal sputum, mucosa, then footpad epithelium and the hair skin of the neck. So this way it can be this diagnose and give the confirmation. And so far the differential diagnosis, as we have already discussed about, the clinical signs very typically for this diaphagic fever with respiratory signs and neurological signs and hyperkeratosis of the nose and footpad, that is very much characteristic for this disease. So that should be always in your mind. However, in the other disease conditions like this canine infectious canine hepatitis, herpes virus infections, parainfluenza, leptospirosis and all, so they may also show some this similar signs and symptoms. That's why differential diagnosis should be done. And even rabies may be sometimes a little bit confusion because of the salivation and this nervous signs. Okay, so that should be considered, right? Then next is about your canine infectious disease. Anybody is waiting to join? No. So next disease is about infectious canine hepatitis. The synonyms are Rubert's disease, hepatitis contagiosa canis, or Fox encephalitis. It is another very important, highly acute and highly contagious this form of this, this viral disease, affecting almost all the ages. Okay, and here also there will be high rise of this body temperature with severe vomition and diarrhea, and the nervous system involvement showing convulsions. Okay, and in this case, the name itself, this infectious canine hepatitis. That means liver is one of the target organ. Most commonly affected in this infection. Okay, so that's why this disease, whenever you find and this suspect this disease and all, so mostly liver will be affected, showing severe hepatitis. And along with these two more organs, those are kidneys and eyes, that also used to be commonly affected. Okay, and here very typically, of course, first let me tell you this causative agent caused by canine adenovirus type 1. Okay, and this genus is known as this masked adenovirus. Okay, so here I would like to tell something. These things, this host susceptibility and this mode of this spread and all, I will skip it. It is not difficult to understand. To please go through it. And first, I'm just coming to the pathogenesis. Okay, this virus normally is getting entry through the nasopharyngeal, this or this oral or conjunctival route. Okay, means nasopharynx, oral through ingestion or through inhalation, ingestion or contact, means mostly the conjunctival routes. So after that, the initial infection, this viral occurs in the tonsillar crypts as well as the bare patches of the intestines. Then they will get into the circulation causing viremia, and infection of the endothelial cells as well as the parenchymal cells in many of the tissues and organs, causing hemorrhages. And mostly the three and these organs, of course, as I was talking about, liver and kidneys, and sometimes, of course, spleen and lungs may be affected, but mostly liver and kidneys and eyes. In that case, when the eyes used to be affected, okay, very typical here. I would like to show. I will show you this picture also just after this. Very typically, there used to be blue eye condition, means bluish discoloration of the eyeball due to corneal edema leading to opacity or cloudiness and turning into bluish color. So that is known as blue eye condition. Very typically, maybe this mostly both eye. Okay, it used to be bilateral. And whenever you see this affected dog from a distance also, you will find that eye is highly opaque and cloudy, showing bluish discoloration, what called blue eye condition. That is very much typical. Okay, and most of these vessels and this organ and tissues, whatever I have mentioned, liver, kidneys, spleen, and sometimes lungs, and all. So they are causing, this this infection, where hemorrhagic and the necrotic changes mostly used to be there, right? And there will be massive destruction of the hepatic cells. That's why, due to this liver failure, this acute this hepatic failure, so acute death used to be happen, and a intranuclear inclusion body used to be present in the hepatic cells, liver cells. And so far the kidneys are this concern. Kidney chronic lesions and this chronic form of these lesions leading to glomerulonephritis, where immune complex, this deposition used to be there. And mortality used to be 10 to 30%, or even it may this come up to 10% in the young puppies, and expected to be more when it occurs with or shortly after canine distemper. That means if the dog has been, already, this affected or suffered from the canine distemper, followed by this infection, okay, then it would be more, this mortality, more severe form, and mortality rate will also be very much high and more. Then incubation period, of course, may be different when it is through ingestion, maybe within a few hours, or when the dogs are kept together through contact and all these things, it may be a little bit longer, means 6 to 9 days, right? So the clinical signs and symptoms may be of 3 types. That means per acute form, sudden death, and without, this showing much clinical signs and symptoms. When the dogs were, this almost normal during the night time, next morning you will find them dead, like, without observing any typical clinical signs and symptoms, sudden death. And that's why normally people used to suspect body poisoning cases, okay, but it is due to this disease, per acute form. Then acute form, which is the most common and the important one, and high rise of this body temperature, depression, anorexia, vomition, bloody diarrhea, and abdominal pain used to be there. And when the dogs are having this abdominal pain, and one expression by this affected dogs used to be that is known as moaning sounds, crying type, little bit, because of the pain they cannot, it is not, they are not relieving it, and they cannot control it. Okay, so that time they used to produce a typical sound, moaning sound. That is one crying, and this crying type of this sound. Okay, then there will be this pale mucous membrane, almost all the this visible mucous membrane, like the conjunctiva and all these things. So there would be pale in color, and even there used to be this jaundice. Why it is there? Because of the affection of the liver. Okay, so erythroid and this side, this lysis may be there, and causing depletion of the this RBCs, and separating the this bilirubin, globin, and this heme portion and everything. So as we know, this how jaundice used to happen, right? Then the temperature may fall down suddenly to the subnormal level, and in this case, normally that used to be there. Okay, and a transient corneal opacity, as I was talking about the corneal and this edema. Okay, some edematous fluid used to be accumulated in the corneal and this epithelial layer and this in between. So in that case, they used to show corneal opacity, and it turns into blue in color. So that is known as blue eye condition or hepatitis blue eye. Okay, I will show you on the picture this after this. And the subcutaneous edema may also be observed in the neck region, head, as well as the abdomen. So this is about the acute form, which is the most important, and most of the dog's cases used to be in this form. Then some mild form or inapparent form, where this clinical signs are mild or subclinical. Okay, maybe a passing temperature, some mild photophobia, or mostly they used to get recover from that. And in this case, recovery of the weight loss during the illness used to be very slow in the affected animals. Of course, it takes time to recover their weight loss and to regain it. Then there may be conjunctivitis, some serious discharges from the eyes. So this is the one. Very typically for this, this infectious canine hepatitis, so bilateral corneal edema or iridocyclitis. Okay, cyclitis, leading to corneal opacity and giving a blue eye and this coloration. Okay, so this is very much typical. So mostly it used to be bilateral. Okay, and if it is there, then and this temperature, of course, jaundice is also there. They are also very weak and showing depression and all this, and then you can suspect that, or maybe this disease infectious canine hepatitis. Okay. Then this is replication from different sources, the clinical scientists also. Then coming to the lesions, the three organs mostly we have talked about this liver, kidneys, and the eye. Okay. Then other, of course, the lungs, then the spleen, then the lymph tissues also may be there. So far the liver is concerned. Liver used to be very much congested, much enlarged, mottling, friable, and fibrous exudation. If you see from the this outer surface and all. Okay, means if you open the this abdominal cavity, you will find these are very much congested and much enlarged. Okay, increase in size, mottling appearance, and friable, easily breakable, and some fibrous exudation may be there on the surface. And some linear hemorrhagic lesions may be present on the serosal layer of the stomach, and the spleen and the other lymph nodes, maybe edematous, and this highly congested, and the gallbladder. Okay, when you open the this gallbladder and all, so it used to be the wall used to be highly thickened and edematous, and as a whole, the gallbladder used to be much enlarged. Okay. And these are some more this picture showing the this very much enlarged and this congested liver. Then this gallbladder showing edematous thickening of the wall, and this then enlargement, and multifocal hemorrhagic lesions in the lungs like this. Now coming to the microscopic lesions. So in liver particularly, means which is the most target organ for this disease, there will be focal hepatic necrosis, mostly in the periportal area. Just around the, the lobule. Okay. So there, this periportal area, the hepatic cells used to be necrotic, this lesion used to be there. And almost the hepatic cells maybe showing, just some intranuclear inclusion bodies. Okay. And those are those hepatic cells just around or nearby the necrosis used to be there. Okay. So those hepatic cells, mostly they used to show the intranuclear inclusion bodies. So this is very common. And there may be dilatation of the sinusoidal spaces in between these hepatic cells. This this species. These are known as sinusoidal this species, sinusoids. Okay, so it may be dilated. And this type of this intranuclear inclusion bodies, as I was talking about the hepatic cells just around the nearby the areas of this necrosis. So other cells like this reticuloendothelial cells and the endothelial cells of the spleen and the endothelial cells of the glomerular tufts, they may also show the presence of similar type of these intranuclear inclusion bodies. So these are some more, I'm just picture showing these intranuclear inclusion bodies like this. Okay, these are the cells, hepatic cells nearby these necrotic lesions. So they are showing this, type of this intranuclear inclusion bodies, right? So these are some, this intranuclear inclusion bodies. Another, and this is in case of the mesangial cells in this kidney. This is in case of the liver. And finally, diagnosis based on the clinical signs and symptoms, but it is difficult. Only thing you can suspect that, by observing the clinical signs, mostly the bilateral corneal opacity, what we call hepatitis blue eye or blue eye condition, right? So you can suspect it, but it is not easy to say that it is you can suspect. But confirmation only by laboratory diagnosis based on, this for the detection or isolation of the virus from the nasal secretions, sometimes from the blood, urine, and affected tissues collected during the postmortem examination. And the microscopy examination, of course, when you collect the liver, which is highly congested, enlarged, and just some necrotic foci are there, like, then if you make section, see under the microscope and all, so you have to find out the presence of the intranuclear inclusion bodies of those hepatic cells just nearby the necrotic area. Okay, so that is very important. Then, of course, the detection of the, examination of the blood for the detection of cells, clinical pathology, and for this liver enzymes and all these things. Okay, and you can go for this isolation of the, this blood virus antigens, antibodies by different techniques like this fluorescent antibody technique, AGPT, then ELISA, okay, virus neutralization test, heme agglutination inhibition test, and this PCR for detection of the viral this nucleic acid. Okay, so that's all about this canine and this infectious canine hepatitis. And lastly, for today, I'm just taking up another this disease which is very much important. So far, our northeastern states are concerned. Presently, in Manipur also, and Mizoram also, and the other and this state also, very commonly, the dogs are having a problem of this infection, parvovirus infection, and many of these dogs are dying. Okay, presently means it is happening and it is prevailing, and this canine parvovirus infection. Okay, so that's why it is one of the most common infectious diseases of the dogs in the northern state of India and other parts also, of course, and even in other parts of the this globe, this world. Okay, and this disease is highly contagious, and one very characteristic feature of this disease is that the affected these dogs, okay, they used to show the sign of severe diarrhea, this bloody diarrhea as well as bloody, this vomition, diarrhea also, vomition also. And if it is, of course, the very severe form, then it will be bloody in nature. Bloody diarrhea as well as bloody vomition. Okay, that is very severe form. Or, if it is not that much, of course, the blood is not there, but diarrhea and this vomition also will be very much severe. Okay, so that kind of this disease it is when it is having that problem, and they will just stop taking food and all these things. Okay, and so this, this disease can be affected, and it is going on now. And without, what to say, this vaccination, of course, so far the viral these diseases are concerned, vaccination is the most preventive measure to prevent from getting infection of these things. Once infected, means there is no specific treatment, only symptomatic treatment as well as supportive treatments are there. And so far this disease is concerned, supportive treatment is very much essential. And if not vaccinated, of course, it is very much difficult to save also. Once it go on and it starts showing bloody diarrhea and this bloody vomition and all. Okay, so due to hypovolumetric shock particularly, okay, one of the most common mechanism cause of that is due to volumetric shock or hypovolumetric shock. Okay, due to excessive loss of this body fluid or this blood. So that is the main and this cause of that. So that's why it is very much important to understand to know this disease. Okay, and it is caused by a virus known Canine Parvovirus. This and having two different type of these syndromes. It may be acute myocarditis and hemorrhagic enteritis. That means two organs, mostly the GI tract, intestines. Okay, mostly, or the stomach also maybe. Then the heart. These two are the target organs or system, you can say, used to be affected. So that's why it may be of the clinical sign or the syndrome symptom, maybe of acute myocarditis or hemorrhagic enteritis. Okay, so that means it is almost confined these two anatomical organs or structures, but it is not that it is truly and is limited to this only. Others also may be affected, but mostly they used to target these two organs. That means heart and the GI tract. Okay. Then history, I will just skip it. Please go through it. I will give you the PDF form and this letter. Okay. Then geographical distribution also I will this and then this also I will just skip it. And so far the spread of this disease is concerned mostly through contact with the feces coming out of the affected dog, which contains huge amount of these virus particles. And these viruses are known to survive also on inanimate objects like clothing, food pans, and the cage floors where these dogs are kept for 5 months and longer even in right conditions. Okay, right, and this favorable and these conditions. And the insects and the rodents may also serve as vectors, okay, for transmission of this disease. Possibility is there, means some reports, okay. And the normal incubation period of the disease is 7 to 14 days. And active excretion of these virus particles in the feces of the affected dogs start on the 3rd day of exposure from the infection, and often before clinical signs appear, means before starting showing the clinical signs and symptoms. Okay, and after 3rd day of this infection, but they have not started showing the clinical signs and symptoms. From there, they may start excreting the virus particles in their feces, and it may last for 1 to 2 weeks even after the onset of the disease. Means even after showing the clinical signs and symptoms, they may go on excreting these virus particles in the feces for 1 to 2 weeks even after the exposure or the infection, right? Then this is the life cycle of this parvovirus. Getting this contact with this virus, okay, through the feces contaminated and this ingested along with the food particles and all these things. Again, it will excrete through the feces and all, so it will go on having this cycle like this. Okay, then this is another this clinical syndrome. That so far the host vitality is concerned. So the immune experience and vaccination status of the animal, the dog is concerned. How much they may be experienced, and this affected severely, how much severe and all. And the number 2 is environment, means depending upon the humidity and the temperature of the particular area, okay, and the virulency of the virus. That means how much virulent, mild, and this moderate or highly virulent. So depending upon these 3 factors, the sign and symptom and severity of the disease varies. Okay, then so far the protection is concerned. This of course when the puppies, when they are suckling milk from this mother, mostly the colostrum, which contain the maternal antibodies. So that's why these young puppies used to have protection until 2 months of age. Means it may protect from this infection up to 2 months maximum. Then that's why means you have to go for regular vaccination and keeping the dogs indoor until the vaccination series are complete. Otherwise, there is a great chance to contact and to have and contact from this infection or disease, right? And coming to the pathogenesis, actually this mostly through ingestion of the contaminated food and water. Then virus starting and this replication in the pharyngeal lymphoid tissues, and the S phase of cell cycle have receptors for this virus when they are getting into the circulation, and mostly they used to affect the lymphocytic cells, this WBC leukocytic cells, causing severe destruction of the WBCs. So there will be leukopenia, reduction in the number of these WBCs, and the cells, particularly in the crypts of the intestine, the intestinal epithelium, okay, mucosal layer there, and there's the crypts and all these things, okay, mostly they used to be affected and desquamated, destructed, and that's why these cells are highly susceptible for getting infection in the GI tract very severely, and the severe desquamation, destruction, and even necrosis of this very particular this villi, microvilli, and all these things, and the crypts of the liver cone, and so that used to be there. So that's why means easily they used to get this this infection from the secondary invasion when they are getting into the GI tract and all, because there are not any more this protection from those, because this layer, because of the destruction, desquamation of the villi, microvilli, and all those things, right? So that is another, and this reason for severity and leading to this cause severe diarrhea and death and all these things, not only due to volumetric diagnosis, this thing, septicemia, okay, from there it may cause. So this is another schematic diagram for this pathogenesis. So from this tonsils replication of the this virus started and going into the circular blood circulation, affecting the lymphocytic cells, replication in those lymphocytic cells and all. And after that, this lysis of the cells, virus will be coming out of the these cells, and they will be present in the this circulation, and that what we call this viremia, presence of virus in the circulation, and they used to target mostly the bone marrow, the stem cells, and the GI tract, and of course this organ, another, that is the GI tract is the main this organ, of course this bone marrow and the stem cells, where the production of this the cells, blood cells used to be there. So that's why the production will be very low in such cases. And coming to the clinical signs and symptoms, and a majority of this infection in case of this dog observed mostly in those dogs less than 6 months of age, but most severe cases of these dogs used to be in the puppies younger than 12 weeks. That means 6 to 12 weeks. This is the most, this commonly observed, this clinical signs and symptoms. Okay, and the most common form of the disease is the intestinal form, commonly known as enteritis. Okay, so where the GI tract is severely affected, causing this inflammation and this enteritis and all. So in such cases, the main clinical signs and symptoms are this vomition, maybe of very severe type and even bloody, then diarrhea, then also bloody diarrhea may be, leading to severe dehydration and dark and bloody feces, and this in the severe cases there may be high rise of this body temperature with reduction in the number of this WBCs, leukocytic count will be very much less. Okay, and this kind of this acute parvovirus enteritis, usually it used to be observed and seen in case of the dogs of any breed, sex, and age. Means there is no any this difference and in the breed, sex, and this in any age group, in any breed, in any this sex, may be male or female. So it may be this observed, and the disease may progress very rapidly, and that may cause after early as 2 days after the onset of the disease, means after getting the infection and starting showing signs and symptoms, within maximum 2 days the dogs used to die. And the presence of this if there are no presence of bacteria, for example, when there are presence of this gram-negative bacteria, parasites, and other viruses in connection with or in addition to this the virus, this canine parvovirus infection, that means concurrent infection. Okay, then it will be a very severe form, and it will worsen the severity of the disease, and this kind of dogs affected with mixed infection type. Okay, concurrent infection. So they will be very much slow in recovery. And the less common form of the disease is myocarditis, acute myocarditis, involvement of the heart. So due to heart failure, another cause is due to heart failure, the dog may die. Another is your, volumetric shock. Okay, so whenever you see this affected dog in the cage or where the dogs are kept, for example, and they will be showing high rise of the temperature, they will be very much lethargic, and the loss of appetite, and very severely dehydrated and emaciated, and the severe vomition also may be that may be bloody, or without this blood also may be diarrhea, which used to be watery in nature, bloody, with a very typical smell known as telltale odor. Okay, telltale odor is a very typical smell. I cannot explain it without showing the exact this smell. Of course, during the post-mortem examination of this type of these cases, this canine parvovirus infection, then only you will feel that what a typical smell it used to be. Once we have conducted this post-mortem examination, during those this time, the students have experienced it. Otherwise, I'm very sorry, how to explain it. Very typical. When you open, of course, even the intestines, the intestinal content, or even the feces coming out from this affected dog. Okay, so you used to be having this very typical smell. Even after washing your hand with so many, this soap and all these things, it doesn't go. It seems that, it used to remain, it seems very typical. You will not be able to forget it, like once you smell it, like, so that type of this typical smell used to be there, and it's commonly known as telltale odor or smell. Okay, and very severe, this hemorrhage, this bloody diarrhea, and bloody vomition, if it is severe. And if it is not severe, of course, severe vomition and the diarrhea, watery diarrhea may be there. If severe, then blood also will be there. Okay, that is indicating. And as I'm showing here, see here on the floor, the watery and this diarrhea, bloody diarrhea. And when you open the, this carcass, the abdominal cavity, one more typical lesion, this is of course about the lesion. So if you open the intestine, you will find that little bit yellowish, or sometimes empty also may be there, or if it is yellowish and the watery type of this content, giving that very typical smell. And if you take out this content, and if you see the this intestinal mucosa and all, you will find severe hemorrhagic lesions. Okay, and even from the serosal layer, as I am showing here, some part of the intestine, from the serosal layer without opening the intestine, you can see the hemorrhagic lesions, even very severely this showing hemorrhages here. Giving the very dark red in color. Okay, then when they are having this hemorrhagic enteritis, as I have already mentioned, that the villi, see, of this intestine, villi, microvilli, and all these things, so they used to be desquamated and destructed. That's why it becomes very much blunted and unable to absorb any nutrients. So that's why the affected animal is not getting the nutrients properly, which should be absorbed from the contents which is coming through this intestine and all, through this stomach and all this thing. Because of the destruction and the blunting condition, the squamation of the villi and the microvilli and all, so those nutrients cannot be absorbed. Okay, and sometimes the GIT flora, I mean microorganisms, okay, so that may also be easily getting into the system from this affected and this intestinal mucosa, and where the villi have already been blunted and the crypts, these crypts of livercune, these are also already damaged, and that the microvilli are also already damaged. So in this condition, so the animal will not be able to absorb any kind of this nutrient, and the viral, any this bacterial or this organism getting into the GI tract, so they will be getting into this and they will affect easily this kind of this intestines. Okay, they will invade it. So that's why if you are asked what are the mechanisms of that in case of parvovirus infection, okay, as I was talking about, I mean this this severe, highly fatal, this kind of this thing. So as I have already mentioned you that diarrhea is one of the this thing, and the vomition. So because of this severe diarrhea and vomition, maybe bloody or without bloody also. Okay, so what happened is that the animal used to suffer from extreme dehydration, and because of that, what will happen? They will get shock. What kind of shock it is? Means they are losing body fluids. Okay, and this electrolytes and all this thing. So they will get shock. That is known as hypovolumetric shock. So because of shock due to extreme dehydration and losing of the body fluid and electrolytes, when the animal is having diarrhea and vomition very severely, so they will die. That is one, this mechanism. Another is loss of intestinal barrier, as we have already discussed about the affection of the villi, microvilli, crypts of livercune very severely, right? Then absorption of your, these nutrients will not be there. And the bacterial invaders, these microbial organisms getting into the GI tract, so they will get easily into the system, causing septic shock. I mean, they may produce some toxins by this intestinal, this microflora or the bacterial organisms roaming throughout the this bloodstream, going into them, producing these toxins and all. So they may cause another shock, what we call it septic shock. So these are the two mechanisms, and the third one, of course, it is not mentioned here. It is due to heart failure. When the heart is targeted and affected, leading to acute myocarditis. So heart failure may be there, and that may be another third this mechanism of that. Okay, these three are the different mechanisms of that due to parvovirus infection. Then this gross and histopathological findings, of course, means one gross, already I have mentioned you that, the hemorrhagic, very severe hemorrhagic, and this severe congestion and hemorrhagic lesions on the intestinal, this tract mucosa, and content maybe of, sometimes it may remain empty in some cases, or sometimes it may be containing some yellow or blood-thin fluid, which is giving a very typical smell, what we call telltale smell. Okay, and the lymph nodes, almost all the lymph nodes used to be affected, and they are much enlarged and edematous with hemorrhagic lesions, and the thymus gland used to be atrophied. Okay, and there may be pulmonary edema and the hydropericardium. In some of the these cases where the involvement or lesions of the heart used to be there, causing acute heart failure. Because of that, pulmonary edema and hydropericardium used to be very common when this involvement of the heart used to be, affection of the heart used to be there. And some pale streaks may be visible on the myocardium in those cases, and some with this acute heart failure used to be there, right? And focal areas of necrotic lesions in the myocytes, edema and the lymphocytic infiltration is also common in this myocardium if you make the section of the heart, right? Then presence of vascular inclusion bodies in the acute cases, and in chronic cases there may be interstitial fibrosis and scarring maybe this present. Okay. So these are some of the these pictures showing the very typical linear congestion as well as linear hemorrhagic lesions on the intestinal mucosa after taking out of the content, and sometimes there may be some red or somewhat ulcerative and this lesion, some ovoid on circular type, okay, and giving very typical, the very much prominent and clear picture of punch out bullet. That means very much prominent and it is very much distinct from the surrounding area, okay. And that is particularly on those areas where the, this pair patches used to be there. These are the lymphoid or tissues in the intestinal tract, right? So that used to be very severely affected. So they will show severe ulcerative, necrotic, and this hemorrhagic lesion. And it used to be very much prominent and very much distinct as compared, from the, surrounding area. That's why this is termed as punch out, okay. Punch out pair patches, okay. And severe hemorrhagic enteritis even visible from the serosal layer without opening, and affected hearts in the the section of the heart on this muscles and all these things. So intranuclear inclusion bodies, okay, which used to be present in the this myocardial cells, myocytes, okay. Then these are some of the biopsy of the small intestine collapse and this crypts of the liver cone, and the depleted this this necrotic lesion and ulcerative lesion of the pair patches. And inclusion bodies used also to be this observed in the this crypts of liver cone in case of this electron microscopic picture here. Then finally, diagnosis based on the clinical this history, then the clinical signs and symptoms, and you can go for detection of viral antigen and antibody by the serological techniques like ELISA, where false positives with recent vaccination may used to be there. If it has been given and this recently this vaccine, then some false positive case also may be there, right? Then you have to detect the antibody titer, the biopsy examination, and necropsy examination, mostly the lower and the middle small intestine, to describe, to see this changes as we have already seen, linear hemorrhagic or this congestion and the necrotic ulcerative lesions and the pair patches and all these things, or this bone marrow to see this destruction of the stem cells and all, right? So lastly, this diagnosis, as we have already discussed about this ELISA and all these things, some more and this diagnostic techniques can also be done by this laboratory, these techniques of this CBC, the complete this blood picture and this examination, okay. All this in these are also important. And lastly, differential diagnosis. Some this similar type of these diseases you may come across. Those we have already discussed, that is about canine distemper, infectious canine hepatitis. So these two are very common also, these two. And most commonly means you may come across this, along with this also, like, so, and maybe it is confused, okay. So that's why you should go for differential and this diagnosis from the to rule out from this disease. And others are canine coronavirus infections, salmonellosis, campylobacteriosis, hemorrhagic gastroenteritis, and toxicosis. So that's all about the three important these canine diseases, viral diseases, this in addition to your rabies. So these are all this important so far your examination is also concerned, right? So that's all for today. Okay, thank you.
Thank you, sir.
Thank you, thank you.
Thank you, sir.
Thank you.